Everyone receiving aged care services has the right to safety, dignity, respect and choice. Your aged care provider must protect these rights and minimise the inappropriate use of restrictive practices. What are restrictive practices and what do you need to know? A restrictive practice is any practice or intervention that restricts your rights or freedom of movement. Sometimes restrictive practices may be needed to keep you or others safe. Providers can only use a restrictive practice as a last resort to prevent harm, in the least restrictive way, for the shortest possible time, and after carefully thinking about how it could affect you. There are 5 types of restrictive practices. Chemical, using a medication for the primary purpose of influencing behaviour. For example, using a medication to alter your mood or behaviour. Environmental, restricting free access to all parts of your environment and the community, including items and activities. For example, restricting access to an outside space, such as a courtyard, or putting your walking frame out of reach. Mechanical, using a device to prevent, restrict or subdue movement. For example, work is lowering your bed to the lowest height to stop you from getting out. Physical, using force to prevent, restrict or subdue movements of the body. For example, holding your arms down to stop movement during personal care. And seclusion, using solitary confinement in a room or physical space to influence behaviour where voluntary exit is prevented or it's implied that leaving is not allowed at any time. For example, taking you away from the presence of others to a room where you are alone and you feel you can't exit. Before a provider can use restrictive practices, they must make sure an approved health practitioner, such as a registered nurse, assesses you and discusses other options with you. Discuss the restrictive practice with you. Discuss and try other strategies first. Get your informed consent to use the restrictive practice or consent from your restrictive practices substitute decision maker. And develop an individualised behaviour support plan. If a restrictive practice is needed, your provider must monitor your health and well-being for any changes or decline. They must also regularly review the use of the restrictive practice and stop using it as soon as possible. If you, your family, supporters, or restrictive practices substitute decision maker have concerns about your care, speak with your provider. You can also talk to the Older Persons Advocacy Network or contact the Aged Care Quality and Safety Commission.